Hey guys, welcome to this week's video all about sore throats. If you've got a sore throat right now, you have found the right video. I'm going to teach you how to get rid of a sore throat, and I'm going to look at sore throat home remedies that everyone can do that's going to help. So, as I say, winter is coming, okay? And I'm gonna help you guys get rid of that sore throat. So let's begin. So welcome to my channel. If you haven't been here before, we talk about everything medical and healthcare related. All of the information that we give is evidence-based, so you know you can trust the information. It's gonna help you as well. So I really hope that you find this information helpful today. If you find any of it helpful, if you find any of it new and you're like, you know what, I didn't know about that, don't forget to click that like button. It's gonna help me, it's gonna help the video grow, it's gonna help the video grow to a larger audience, so it can help more people out there who have got a sore throat right now. As always, in the description below, this whole video will be chaptered, so feel free to click on the description and click on the relevant chapter if you want. But as I always say, watch the entire video and that's going to make you a sore throat pro. So let's begin with the basics. A sore throat is a common symptom of the common cold or the flu, and it's basically inflammation of the pharynx that's behind your throat. Also, please do bear in mind COVID related symptoms as well. Sore throats now are seen in some COVID patients, so please do bear that in mind, and please follow local guidance on the COVID symptoms and what to do and the testing and all of that sort of stuff. I will leave more information about that as well in the description below, but for the entire of this video, I'm going to put you down as you don't have COVID, you've done the test and it's all come back negative, and most likely you've got a common cold or the flu. Now, the most common cause for a sore throat is viral, so like I said, from a common cold or the flu, but you can get it from other things as well. For example, if you smoke, all those harsh chemicals hitting the back of your throat can cause a sore throat as well. The other causes of a sore throat as well can be bacterial, so for example, if you have laryngitis, if you have tonsillitis, if you have strep throat, all of these can cause a sore throat as well. Now, if you are a bit worried about having a sore throat and you want more information on when you should seek medical attention, I am going to leave it all in the description below, and it's also going to be towards the end of the video as well. And also, before we move on to the treatments of a sore throat, let's talk about the symptoms of a sore throat. So obviously, you've got a sore throat, you've got the pain when you're swallowing. Sometimes you can get some inflammation in this region as well. And looking at the back of your throat as well, sometimes it can look a bit red, inflamed, and sometimes you can have a bit of a dry throat, especially when you're swallowing, and sometimes you can even have bad breath. These are the most common types of symptoms of a sore throat. Now, in terms of home remedies and treatments to get rid of a sore throat, the way I'm going to structure this video is first we're going to talk about the home remedies and what you can do, because that's probably what you're going to try first, and it's probably the things that you've got at home that you can easily use. And then we're going to talk about medicines and stuff like that you'll probably have to go out and buy, and that's why it's probably going to be a little bit more difficult for you. So we're going to do it in this structure. So moving on to tip number one. Tip number one is about gargling warm salty water, okay? You need to make yourself a salt water rinse, and if you haven't used it before, it's probably one of the best things that you can do to help reduce the inflammation in the area and give you some relief from that sore throat. The other video that I have about sore throats as well, this is one of the top tips that I give on it. I think that video's had over 2 million views or something, and it's probably one of the most common comments that we get, that people are really finding the salt water gargle helpful. So if you haven't done it before, I'm going to teach you how to do it. It's really, really easy. Whack on the kettle, then let the water cool. You want the water to be at a cool, sort of tepid temperature. It's not going to burn you because you're going to be gargling it in your mouth. After it's cooled, get a pint glass or a mug or whatever, and get half a teaspoon or even a teaspoon of salt is fine. Throw it in there, pour the water in, mix it in. Next thing you want to do, go to a sink like so, because it's going to be messy. Go stand over the sink, get your cup or your mug or whatever it is, put it in your mouth and gargle it. Gargle it for a few seconds and then spit it out. Make sure that you're not swallowing the solution. That's one of the most important things that you don't want to do. Now, if you do accidentally swallow a bit, it's not the end of the world, but try not to swallow any. Do this as much as you want, repeat it a few times, and you can do it as many times as you want throughout the day to give you that symptomatic relief. It's going to be really, really helpful. It's not suitable for children, so please do remember that, okay? And in terms of children, how old are we talking? I'm talking like any child probably under the age of 12. As long as that child can, you know, do it quite easily along with the adult showing them as well and making sure they're not swallowing it, it's completely fine for them to do it as well. But if you're worried that your child's going to be swallowing, then 100% avoid it with the children. Moving on to tip number two, consider hard-boiled sweets or lozenges. They're both the same thing. These are great because you can get them either medicated or non-medicated. First, we're going to talk about the non-medicated ones. You can get like honey and glycerol and stuff like that in them. And they're just going to help soothe the area. That sucking action can actually be really helpful at reducing the pain around this area and region and helping to send the stuff down And it also helps to reduce the dryness on the back of the throat that can sometimes make the sore throat worse. So give that a whirl, see how you get on. Moving on to tip number 3, it's all about humidifying the air. Remember how I said to you the back of the throat can get quite dry, and this can sometimes make your symptoms much worse. So if you have a humidifier, this is great at humidifying the air and helping to relieve those symptoms. If you don't have that, not to worry. If you go for a nice warm shower, for example, you can spend a couple of minutes in the shower as well, in the bathroom afterwards, breathing in, and this is just going to help humidify that area. The other thing that you can do as well, if you don't want to have a shower all the time, or you can't do that, is you can also get, just get a small bowl, fill it with some boiling hot water. This is only really recommended for adults, by the way. And you can just get a towel, a large towel, put it over it. Make sure your face is quite far away from this bowl because you don't want to burn yourself. Breathe in through your nose and have your nose roll out your mouth. Doesn't really matter. And that's going to help, again, increase the humidity and help with those symptoms. So these are things that you can do at home really easily. Now, moving on to tip number 4. This one is a bit of a medicine related one, but please remember, antibiotics are not always the answer, okay? I think about 1/4 of all unnecessary antibiotic prescribing in the world is for sore throats, okay? And only about 10% of sore throats actually need antibiotics. So the 90% of them, so 90% don't need any antibiotics because they're not bacterial in nature, okay? Again, we're going to talk about strep throat and all that sort of stuff later on in the video and when to seek medical attention, but please bear that in mind. Don't put pressure on your healthcare professional to prescribe you antibiotics. Don't be that guy. Don't do that to your healthcare professional. And also, please don't be that person who's got antibiotics at home that they haven't used up and haven't finished. First of all, you should always finish your antibiotics, but don't be that person who has antibiotics left at home and then they start taking them for no reason. All of this is just going to cause an increased risk of antibiotic resistance, and this is already a battle that we're facing at the moment. It's just going to make things much worse. So we need to keep antibiotics as our precious resource to use as and when it's needed for emergency situations. Moving on to tip number 5, it's all about fluid intake. We need to make sure that we're having plenty of fluids, okay? And by fluids, I mean water. You can put some lemon juice in it, you can put some honey in it. All these are going to help soothe the area. Try and avoid highly caffeinated drinks. So coffee isn't the best for it because coffee can dry out the area as well, especially on the back of the throat. The caffeine can, so sometimes it can make the sore throat worse, but you can have tea and stuff like that. It's not too much caffeine in there. But please do remember that when you're having these warm drinks, make sure it's not boiling and piping hot, okay? You need to make sure that you're letting it cool until it's like a normal sort of tepidly warm temperature, okay? Don't be having your tea straight out of the kettle into the mug and you're just having it, okay? First of all, it can increase your risk of mouth cancer, throat cancer and all that by having really hot teas. And also, it's gonna make your sore throat worse. Now, moving on to tip number 6, it's all about food and drinks. In terms of food, soups can be really helpful because they're getting the fluid intake in, and they can also be really soothing for the back of the throat to help with the sore throat. In terms of other stuff that you can have, ice lollies can be really helpful. That's helping to soothe the sore throat, and also even sucking on ice as well. This can be really helpful too. And moving on to tip number 7. Tip number 7 is really basic, but you need to rest. If you've got a sore throat and it's really causing you problems, you need to rest. Look, we're humans, we're not robots. We need to rest and let our bodies heal, okay? So sometimes you need a bit of you time. So have a bit of you time, relax, and get better. Now, moving on to tip number 8, it's all about avoiding irritants. If you're someone that smokes, you need to try and stop smoking, especially during that period that you've got a sore throat and you're not feeling well. I know it's not easy, but it's gonna make you feel better sooner, okay? If you do want to quit smoking as well, I do have a video on that topic. Feel free to watch. I'm gonna leave it up here and in the description below. It's helped loads of people, and we go through really good evidence-based stuff that really helps people. Also, if you know someone, if someone in your household smokes as well, whether it's cigarettes or vapes or anything like that, you need to tell them to go outside and smoke it there, because all these chemicals are going to irritate the area, just make your sore throat worse. And lastly, in terms of the tips, you need to stay at home until you are no longer feeling unwell, just to help prevent other people from getting it as well. I guess we've all got kind of used to this with COVID and the guidance on that. Obviously, like I said at the start of the video, I'm going to take it that you don't have COVID, you've done all the necessary stuff to make sure that you don't have COVID. But again, if you've got a sore throat and you're not feeling well, and you've got a common cold or the flu and you're just not feeling well, don't go to work, don't spread it. Other people don't want them germs. Okay, so now we're starting to get somewhere. We've done the home remedies, and next we're going to talk about over-the-counter treatments that you can try, so medicines and things like that. Obviously, if you feel like the home remedies have given you enough relief from your sore throat, you don't need to do these, okay? And also, the way that I'm going to structure these is I'm going to put them in stages. So we're going to put them from stage 1 to 4, 1 being the most mild symptoms, 4 being the most extreme painful sore throat symptoms, okay? So we're going to work from stage 1 to 4. Also, so far, if you found any of this information helpful, if you thought, you know what, I didn't know about that saltwater gargle, or you know what, I didn't know about the stuff that he spoke about, I found this really helpful, don't forget to click that like button because it's going to help me and it's going to help the video grow. Okay, so stage 1 is what I'm going to call lowish pain, okay? And for this, I'm going to recommend some throat lozenges that we spoke about before. Lozenges are also known as boiled sweets because I don't think they use the word lozenges in America, so it's just boiled sweets, the hard ones that you suck on, okay? So earlier on in the video, I spoke about them and I just said you can use the lemon and honey ones and stuff like that. There are medicated ones, okay, that have a local anesthetic in them, okay? And that local anesthetic is going to help numb the area because remember, when we swallow, it goes down the back and that saliva that we've been sucking on the lozenge or the boiled sweet is going to hit the back of the throat, okay? And if it's got a local anesthetic in it, it's going to help numb that area. It's also going to numb your mouth and your tongue, okay? So it's a bit like going to the dentist, okay? If you've had some work done and your mouth's a bit numb, probably not as severe, but please do bear that in mind, especially if you're going to be having like a warm drink, okay? Bear that in mind because you might not feel it and you might end up burning yourself, okay? To get these medicated lozenges, you're going to need to go to your chemist, okay? Or your pharmacy or whatever you call it, okay? And you need to speak to the healthcare professional there to see what they've got, see what products they have that contain the local anesthetics, okay? I don't think they'll sell them on the normal bit. I think you'll need to speak to someone about them. Okay, so moving on to stage number 2, I'm going to call this scratchy pain type symptoms, okay? And I find syrups can be really helpful for this, and you can get loads of different syrups such as Simple Linctus. You can get, you know, honey and lemon ones, you can get glycerin ones. So all of these are going to help, again, coat the back of the throat and avoid that sort of, you know, itchy feeling that could cause a sore throat. Okay, so next up we're moving to stage 3. Now we're talking about a bit more painful, you know, a bit more than your average pain. And for these, I'm going to recommend a throat spray. So throat sprays you can get from the chemist. Again, you want it to contain a local anesthetic, but the good thing about these is you can direct it, get it on the point, spray it, and in effect, you know, in a couple of minutes, it's gonna start to numb and relieve that pain. So if you're sort of at a stage 3 level where it's quite painful, these can be really, really helpful. Again, they're over-the-counter treatment. I don't think you can just pick them off the shelf. Here in the UK, you usually have to speak to the chemist or one of the counter staff, okay? In whatever country you are, it might be the same. It might be wrong for your country, it might be completely different. Bear that in mind. Okay, so moving on to stage 4. Stage 4 is what I'm gonna call the most severe pain. If you've got a really, really sore throat, okay, we're going to talk about tablets now, okay? Paracetamol and ibuprofen are your basics that you can try, okay? Just standard medication you can take. It's going to help reduce the inflammation. It's going to help reduce the pain in that area. Obviously, speak to a healthcare professional before you get them. Make sure that you're safe and suitable to use them. Make sure you read the information leaflet because that is the most important thing. Now, the other thing I'm going to talk to you about is aspirin. So aspirin, 300 milligrams, comes as a dispersible tablet, okay? Obviously, again, you need to speak to your healthcare professional to make sure that you are safe and suitable to use this medication, okay? Because a lot of people do have allergies to it, so you need to speak to your healthcare professional and read the information leaflet. I'm going to say it again, because no harm in saying it again. Your health is the most important thing, so please do check that. And if you're okay to have it, you can get an aspirin 300 milligram dispersible tablet. That's the strength that we get in the UK. It might be slightly different in other countries, because I know they're always a little different in other countries. So mix that in with some warm water, okay? Not boiling, just some warm water, it'll dissolve, and you can gargle this. This is more of an intense gargle, and make sure you spit it out, okay? But it's really gonna help reduce the inflammation at the back of the throat, because this is aspirin now, okay? It's gonna help reduce the inflammation and the soreness and the pain, and when you spit it out, after a couple of times, and after a few minutes, eventually it's gonna be really, really helpful at reducing inflammation and reducing that pain, okay? But like I said, speak to your healthcare professional to make sure you're safe and suitable to use it, and ask them about it. Make sure you can dissolve it in water, make sure it's the right tablet and all that sort of stuff, because you don't want to buy the wrong tablet and it doesn't dissolve or it doesn't work for you. Okay, so I really hope you're finding this information helpful so far. Like I said at the start of the video, I'm going to talk about when you should seek medical attention now. I think the best way to do it, because there's a few different points, I'm going to have it pop up here. Feel free to click pause now and give it a read. If any of them you can relate to, you need to speak to your healthcare professional. Okay, so it looks like we have come come to the end of this week's video. I really do hope that you found this information helpful. Also, if you have any of your own tips, please don't forget to leave some comments below because I'd love to read it, and I'm sure everyone else watching this video would love to as well. Like I said earlier, if you found any of this information helpful, if anything that you've learned today has been new, don't forget to click that like button. It's going to help the video grow to a larger audience and help more people around the world who might be having a sore throat similar to yourselves right now. As I always say at the end of every single video, please always remember that you're awesome, and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.